shorty, what your name is? Do you have a man? Who you came with?
All right, y'all, we ready?
Yep.
All right, hit me with the time, Amber, and let me know what's going on with that.
Okay.
Welcome back, y'all. Street Academy Podcast, where we keep 1 foot in the academy and 1 foot in the street seats.
Yeah.
Back again, y'all. We back again. We back. We back, and we back, and we back, and we back, and we back. Yo.
I feel like that needs to be part of the official theme song.
You might need
You know what?
Yeah.
It does. We got the Usher joint we do at the end. Chance the Rapper joint that we do at the beginning.
Right.
So,
Right.
oh, you know what I noticed too, Jackie? There's something that you do every episode, and I always keep it in the edits. No, you don't do it every episode, but it always comes at just the right time when we like talking about how dope we are and how ain't nobody doing what we doing. And then you'll say like, let's go. You know how you say that? Jackie say, let's go. I love it.
Go.
You see me saying like, nigga, hurry up. I got something to do. This episode.
Checking the time.
I love when you say that. I love when you say let's go. Anyway, yeah, so last week was or was it last week, 2 weeks ago, whenever we shoot it, whenever we shot it, we had a great episode about Black mothers mothering, pregnancy stories. I hope y'all checked it out. If you have not yet, it is up on our YouTube page. So definitely go to Street Academy Podcast on YouTube and go check it out. It was powerful, it was inspiring, and so we had to do a follow-up. We had to bring some professionals in to talk more about the topic. It was hot. Facebook Live was going crazy. It was insane. Mark Zuckerberg, he called me and he was like, John, it's too much, bro.
Too much.
John, it's too much.
You're doing too much.
I gotta kill the episode.
He
was like, I look, my people down in where they at, Palo Alto or wherever they at, like, it's too much, bro. We ain't got the staff big enough to handle the episode. I was like, all right, bro. All right, Mark. I'll do it just for you this one time, my nigga. The next time, though, get your stuff together. Cause we taking off. We taking over one city at a time. We taking
I don't even know what song
I don't know that one.
You don't know that one, DJ
I'm not
Khaled?
familiar.
DJ Khaled.
You taking over?
Yeah. Okay.
Yeah. That's a major Khaled throwback.
Yeah, that's
crazy.
a Khaled throwback right there, 2010 or something.
That's
Anyway,
2010.
we back,
That's a
y'all.
minute ago,
Y'all.
a whole minute.
Amber, you want to take us in?
Great.
Take us into the
Sure.
people.
Well, I wanted us to do the transition from like we were talking last week to now we have these two lovely. Sorry, y'all. I'm very excited and I just keep screaming. When I get excited, I scream, I make noises. It's what happened. I'm getting more and more comfortable with the sounds that come out of my body. I know that sounds crazy, but you know what? We need to. That's a part of the whole reason why we are here, because we're just trying to just be all that we are. Black women, we're free. I'm every woman, all of it. But anyway, we're continuing the conversation.
Every woman.
Hey.
Me. I don't know that one.
You don't know the words?
Whoa.
We got a whole musical this episode.
Okay. That's a
Musical.
whole musical.
So the conversation was so mind-blowing last time. We thought we were like, we have to continue this conversation. And we know a few folks who have some perspectives to add. And so in a moment, you will hear from these two lovely ladies about just about birthing, motherhood, so many connections. It's just going to be amazing. We're going to go into our segment called Off the Georgia Dome, which we are going to just say for just a minute, off the Georgia Dome, off of our dome, what are our quick thoughts about the topic? So I'm just going to start with the one man in the building. Quick thoughts about the topic before we get into the conversation, and then we'll go to Jackie, then I'll go, and then we'll go to our guest. And then we're just going to dive right into the conversation, full throttle. Let's go, John.
Quick off the Georgia Dome. As I was going back through the last episode, I felt angry like all over again. You know what I'm saying? Just Du Bois says something in his collection of essays, Dark Water, where he talks about the one thing he could not forgive white America for was its harm and the destruction that it did to the black woman. That was the one he was like, I could overlook slavery, I could overlook Jim Crow, I could overlook a lot of things, but what I cannot overlook is the destruction that you have brought on the black woman. And I feel those same sentiments when I listen to those stories. I talked to my mother about the episode. My mom listened to the episode. She told me about things that she went through, told me about things that other people went through, in terms of, pregnancies. And it just makes, I'm really angry. I'm really even more angered at the medical industry, at the medical system, and at this country for what it has and continues to do to our black women and our black mothers. So I'm mad. That's my Georgia Dome.
I feel like that's a fair sentiment. It's interesting that you like listened to the last episode and left with anger. I listened to the last episode and left with like advocacy is like my word, because part of what I was realizing was that for both of our guests, they had like their partners in the room with them, like they had their partners with them for the whole time. And I was just like wondering, even if it's not like an intimate partner, what about, a parent, a friend, like who is in the room with you, who can advocate for you? Like, what should that person know? How should that person prepare? Because I remember with both of them, they talked about having like these out of body experiences where they weren't even lucid in the moment. So they couldn't advocate for themselves, but somebody was there. So what do they need to know to help to advocate for women in the event that we can't advocate for ourselves?
And with that, that's a beautiful connection to mine, because for me, my takeout box from last time was actually the power of community and just having a village around you. And that is what I'm still just so struck by, is that like we're having this follow-up conversation to people who know, and people who know even more, in the sense of like from the research side or from the professional side of things. And it's just like, this is like the widening of the community. And it's just like, I feel emboldened. I feel like more powerful, because in one way I felt like from that conversation, in some ways I felt kind of helpless. And yet then it's just like, but we know people who can help us now. So it's just like going from like what could feel like powerlessness or what could feel like helplessness. It's just like, yo, we got the knowledge right here. We got the wisdom. They're going to give us instructions. They're going to tell us some more things to think about. And it's just like, I am encouraged by the power of community. I'm encouraged by the presence of the village. And that's where I'm coming from right now. I feel just like as we just keep connecting with each other, we will have all the resources that we need. We'll have the wisdom that we need. So it doesn't have to keep duplicating itself. Like the cycle, we can stop the cycle. And I think that's so important as Black people. Like we don't have to keep living within the cycle. And so information and conversations can help us break cycles. And that's what I'm encouraged by. So that's
Shade.
Let's go to you, Shamika, and then we'll go to Aiyana.
Yes. I feel my grandmother. She comes to me often whenever I'm doing birthing work, studying birth. The grandmothers speak to me, so I like to speak my grandmother's name, Pastor Annie Stanley Thomas. We know that is her slave name. So I invite her into this room. I also invite Mary Turner, who's the first woman who was lynched while 8 months pregnant.
Wow.
The first reported woman lynched while 8 months pregnant. They cut her womb wide open as she hung from the tree and left the baby or the fetus dangling from the umbilical cord. And everyone watched the strange fruit hang twice, her and the fetus. So I like to speak their names. Also like to speak the name of Amber Isaac Rose. She's the first Afro-Latina reported woman to die in the hospital at the start of the COVID-19 pandemic due to being left alone in the operating room. She wasn't allowed to invite her mother or her child's father, and she died alone, cold, lonely on the hospital table. So what I feel mostly is war. I feel war, WAR, war is wartime. And I think as we pull up to web links, as we pull up to universities, to the streets, to the hospitals, to home birth sites, we have to take back the throne. And we do this one step at a time, because peace of mind comes piece by piece. But we also know there is no peace without war. And so this is a charge to the womb to come forth and to proclaim the throne. That's what I feel.
That's powerful. So powerful. To kind of link all of this, there's a lot that's swirling in my head. So cut me if you have to. You all know that I can talk for a long period of time. But it's funny you say war. I'm always like, flip a table. Like, if you have to, like, sometimes that's what we need to do. The first thought that came into my head as Dr. Shamika is speaking is, we continue to go to these places that weren't designed for us. And in addition, the black woman has literally paved the way for these spaces to be in existence now. We are the reason there's Black medicine, or medicine in general. We are the reason that there is the modernization of medicine here in this state. And we have not been thanked for it, not that we're seeking appreciation. We were not asked to be a part of it. We were told we must do it. Our bodies were property to others. And so in the sacrifice of all that, make no mistake, the history, the tradition is still running within us. However, it's gotten all confused with what white supremacy has done, what slavery has done. And so we're now at a place where you're seeing a resurgence. I think, Amber, you mentioned that before, of Black midwifery. Black midwifery is not dead. It has never been dead. We've been here doing our things, even though people have told us no, and tried to shut us out of the hospital system. But we're here, and we're here to fuck shit up.
Basically.
There it is.
I love it. Let's do this.
Yes, yes, yes.
Ooh.
So let's dive right in. Let's go to, who are these lovely ladies who are with us today? Can we just start with you introducing yourself, telling us a little bit about your background, and then sharing what actually got you into the career that you're in now? I invite Aiyana to start.
Sure. I am Aiyana Davison. I am a certified nurse midwife. I practice in Southern California. I do practice within the hospital setting. That will not be forever, or for very much longer, but that is where I practice. What drew me here? I mean, I always want to say, like, it was my own thought, but truly, I think it's the legacy of midwifery. I know John and I used to, we went to undergraduate together, and he used to call me Dr. Davison, Dr. Aiyana. And that was because I was pre-med. I was thinking I was going to go to medical school, but definitely my life has turned in a different direction. And I'm so very grateful for it. I left thinking I was going one route, ended up becoming a registered nurse. It kind of hit me like a ton of bricks. And then wanting to do the same thing that I would have done as a physician, I wanted to really be with people as they were in the most critical or pivotal time in their life, which is birth. One of the most energetic, spiritual, challenging, but amazing times in someone's life, in a family's life. And so midwifery came to me. And it wasn't until my grandmother passed away prior to all this, and I found out that she had been a midwife as well in the island of Antigua. So I knew her to be a registered nurse growing up. I did not know her to be a midwife. She never talked about that part.
Wow.
And so what is really strong, and Dr. Shamika, I really relate to you when you're saying, like, my grandmother, like, I say her name, Eastland Imelda, like, the things that have gone on in her life, I feel like have fortified my work now. My mom tells me this, and this is what's been really pivotal. I knew this before, but like it's even more pivotal for me now. And that's when I was first born, my mom, you know, her mother, my grandmother came to the house, and my mom said, your grandmother would not let me touch you. Aside from like breastfeeding, she like did everything, changed the diapers, did the bath. I was like her sidekick that whole time. And the most powerful words, and I really do believe there was something that she did, but the most powerful words for me were from my mother was, I wonder what she whispered to you while she was holding you. And I deeply feel as if she had said something to me like, this is the work you're going to do. This is what you're called to do. And so midwifery runs through my veins. It is a calling. There are people who choose it, but it truly is a calling. And I'm so glad to be a part of it. So grateful for the experience, and I'm looking forward to how this is going to evolve over time. So that's kind of a little bit about my background in midwifery.
Ah,
Wow.
I
Amazing.
love it. Such an incredible
Yeah.
journey. Mm.
Ashe, Ashe. Thank you for speaking your grandmother's name as well. I feel the grandmother's with us. Yes, I'm Dr. Shamika Poetry Thomas Shazad. I go by Dr. Poetry on the airwaves, so feel free to, join me in this moment in time. Thank you for this opportunity again. How did I get here? How did this moment find me? I think it was 9 months before August 30th, 2011, 5:25 p.m. I gave birth to a queen named Zaya River Atkinset. She will be 10 this year, so we're both turning 10 together. 10 years, a decade of mothering, and we mother each other. When she passed through my womb, not only did she bring Africa with me or to me, but she brought me my research question that later became my dissertation question. I remember breastfeeding and going to go take my GRE. And we were living in the Bay Area. I was in Berkeley, but then we had relocated to San Jose. And I had to let her uncle take her. Her dad was working at the time. And I had to drive all the way up to Sonoma Valley with my breasts engorged with milk because I had my GRE to take. And so I was literally on the road in tears. And I took that entire GRE thinking of my child. And there were moments on the break, I would take time away from the testing break to pump.
Wow.
And when I pumped, I had to meditate in order for the milk to let down. And I also had to have pictures of her in my pocket, my purse, a onesie so I could smell her scent. And so I'm taking this test, but I'm also mothering simultaneously. And the way what it does to your psychology, to your body, mind, body, and soul, it's almost something that I feel as though women, we don't talk about enough. That part of my narrative, I learned to silence at that time. So now I'm bringing it to the forefront to normalize these birthing stories. These are a part of our experiences, and they're here to stay as a part of our own quiet revolutions. So I ended up going back to graduate school to study not just what happened to me, but I started becoming in tune with what was happening to women's wombs. Black women would talk about these stories at the kitchen table. They would talk about these stories in the nail salon, around different types of home care settings, folding clothes. And so I just started hearing the women, listening to the women, listening to the women, listening to the grandmothers, listening to the aunties, to the cousins who had an abortion, to the grandmother who lost a child and no one ever talked about it. So these reproductive birth stories were always happening. They were just silenced. They were silenced. And if you weren't married, your motherhood wasn't validated. So they were even more hushed due to certain undertones of religiosity and Christianity. So what started happening is was my ear started listening in. And then that's how I ended up going back to graduate school to study medical sociology and reproductive health. It was a winding road to get to this point, but nevertheless, my daughter and I, we walked through those waters together. And so when I often talk about why I'm successful, I have to look at my child. So often the narrative is to go to school first, have kids second, but I wouldn't be here if I didn't have my child first. She bought me my dissertation. She was the first person to be ready to go when I was defending. Like I remember the day of my defense, and she literally was already dressed. you know, she's like, "Mommy, today is the day. This is a big day." And so I have to give credit to my child. As a postdoctoral fellow, my focus now is on advanced reproductive health technologies and what they're doing to Black women's bodies. So we're being exposed to non-invasive prenatal testing, IVF, in vitro fertilization, all of these new technologies. But as these technologies increase, birthing is getting worse. And how we have this polarized split between the two, no one knows. Yet we know, but we're not fully knowing, or we're not prioritizing what we know, if that makes sense, with funding and dollars and a dam. That's what I think. So my research focuses on understanding Black women's perceptions of the reproductive healthcare system in the United States. I do interrogate the perceptions of Black women who identify as Afro-Latina as well, coming from Miami, women who could check both boxes of Black or Cuban, or Black and Haitian, or Black and, from Puerto Rico, but they often are presenting as Black women or treated like Black women in everyday circumstances, and miscategorized with white Latinas. So that presents another part of problem in Black health, because Blackness it permeates throughout the entire diaspora, and we forget about how South America has more Black bodies than North America. So I do bring in some additional narratives from the entire Atlantic slave trade and not just North America. So this is how I got to this point. And my goal is to become a professor in a medical school, where we have, unfortunately, a lot of practicing OBGYNs or residents who've never seen a natural birth. They've never seen a natural birth, and they often attribute reproductive health disparities to genetics and not to structural racism or implicit bias, or systemic racism, or residential segregation, or environmental racism. So they often think that it's women's behaviors, you're not eating right, or you're not exercising enough, or you didn't follow the doctor's orders, XYZ, that's contributing to these worse outcomes. But when I talk to patients, one of my patients, she mentioned, my ancestors told me not to go to the hospital. They told me. So you're talking about women who are getting advice on their pregnancies and birth from a different realm, the spiritual realm that's excluded from the Cartesian model of care, which only includes the body. So physicians are taught to only look at the body and not to look at the holistic mind, body, soul. So in my practice, in the way I practice science, I infuse it with spirituality as well, because that is a part of wellness at the core. So that is how I'm here. Yeah, that's all I have to say at this moment.
Wow, there's so much that y'all said that I kind of want to pick up on, because I think it's a great segue from last week, because y'all are talking about maternal health and Black women from like a structural perspective. But last week we had mothers talking about the medical process from their own experience. And so I was hoping that y'all could just like elaborate a little bit more on almost like a follow-up to last week, but like from the medical and structural side, just kind of give us a lay of the land as far as Black maternal health, pregnancy, delivery, from like the structural side, because I'm sure y'all have seen the full gamut.
To kind of continue the conversation here, I think what was impactful in listening to the stories that are told, which is highly important, like just like Dr. Poetry said, what I was hearing is what is a common theme, which is we rely on medicine to dictate to us what is going to be done to our bodies without the consideration of who we are as people, where we came from, how we're raised, just like who we are in general. And that's a long-standing history that's come about. If we're talking about midwifery, Black midwives were at the center of healing for the communities, especially within the South and in early America, because these are people who carried over tradition, their herbal remedies, but we weren't allowed to. Number one, there weren't hospitals to begin with, right? Within the beginning of America, there's not a hospital, there's no institution for that. But even if there were access to it, we wouldn't be able to go. And then on top of that, the people who were healers amongst white communities, which were sometimes us, but overall, they weren't coming to see us. Or if they were coming to see us, they were coming to see us to make sure that the property, as in a person, was okay, because that means money for somebody else. So these midwives are going to communities trying to use whatever they have. So they're like not just delivering babies. And I want to be clear, midwives do a whole lot more than deliver babies. It is a fantastic part of what we do, but we are doing cervical cancer screening. We talk about contraceptive management, which does not always include or limit us to just hormonal birth control. We help with abortion care. We are there to support people during their time of loss. Like, everyone thinks like, oh, your job must be amazing. We go through it with our patients when they're losing their children. And I truly believe, firmly believe too, that part of our job is to be with the person, which is what midwife means. But what also that it expands to is going through the experience with them and uncovering the secrets and all that toxic damage that has been done. So the secrecy that we have within the parenting structure. So it's not until someone experiences a loss and is verbal about it that they then find out that their mother or their aunt or their sister also had a loss, or that they had fibroids as well. We've been silent for way too long. I went off on a tangent, so I'm gonna bring myself back around. but going back to the structural part of it, as America is kind of being built up, as we as Black people are building up America, let's just be real, what's happening is you see the development of the hospital system, and the Black midwives were sustaining communities. They were also sustaining people who had to be wet nurses and breastfeed white families. So they're feeding their own child and also feeding a white family's child. They are going to places where people are experiencing loss and giving them the herbs and medications so that tissue and all that, the remnants, pass through them. They are acting as like a family practitioner, because again, the other healer is maybe miles and miles away and they can't come in, so they have to use what they know to help out, right? So we have this going on, and they're sustaining community. And then you have this structure or this system of medicine that comes in, and they come in and they literally, it's like a bowling ball down an alley, break it all up. And they tell Black midwives, you're not sanitary, you need to do these things this way, you are killing children. Meanwhile, we have these physicians who have no idea about anything about bodies, but come into practice on us. They are doing procedures on us without medication, without anesthesia. Let's be very specific. And again, the Black woman's body was literally the site of all this research without consent, without, again, the anesthetic. And this is how things blossomed into, oh, Black women don't feel anything. Well, number one, if we look at it from the standpoint of slavery, if I say something, you're going to beat me and die. If I don't say something, you think I'm just really, really strong and this Neanderthal that you call me. So there's so many components to what has happened over the course of time. And going back to the midwifery report, so these white physicians are coming in to say, you're not doing these things correctly, even though we've sustained community, and you need to go and take these trainings, and pretty much trying to integrate into the white hospital system. However, that is when I wouldn't say eradication, but when they began to really break down and disperse and try to kill off midwifery as a whole. However, there were people in the community still doing what they needed to do because some people couldn't afford to get to the hospital. And again, even if they went to the hospital, would they get the treatment that they needed? So that's a little bit of the background now, which translates it into the bigger issue that we're looking at now. We keep hearing the Black maternal health crisis, the Black maternal health crisis. This is not new. This has been going on for a while. You'll hear the statement over and over, Black women are 3 to 4 times more likely to die than a white woman. Not even if you consider their financial status, their education, their access to good quality care, they're still 3 to 4 times more likely to die. And if you go to specific states like New York, at one point in time, they are 12 times more likely to die. So when you walk into the hospital, you are a ticking time bomb because no one's listening. They're ignoring, they're missing. And I saw you, John, get upset. And if anyone's ever seen John get mad, he was mad. Talking about, like, you said what to my partner, you're just going to come in here and touch bodies. This is what they do. Let us not be confused. This is how things go. And so this is why it's super important, not only number one, to get the knowledge out there so people know, but so that people are walking in prepared. And I don't want to have folks be confused by my statement, because I'm not saying that this relies on the Black person. The fault is not on the Black person. Right. However, when you are killing Black bodies in a hospital system, it's super important that you go into a space well educated and informed so you can put your armor on and protect yourself. Not everyone has access to midwifery care outside of the hospital. It is expensive, and sometimes they're just not in locations where they're located. There are 7 states right now where midwifery you cannot have a home birth. And I wanted to address one of the statements. Georgia is not one of those states. You can have a midwife deliver you outside of the hospital, but it's the type of midwife that you're seeking care from. So it's very important for people to understand, if one midwife tells you that they can't do out of hospital birth, ask them what type of midwife they are, and then find out who else would be able and willing to do birth outside. That's a very important thing. So nationally, we're trying.
I'm glad you clarified that. That's so important. Thank you.
Yeah.
Nationally, we're trying to make sure that midwifery practice can be consistent across the board. But when you go to different states, there's different laws for allowing us to practice in and out of the hospital. And that's what makes access to care so vast. And, there's this gap, this, healthcare gap in so many different places. So I'm going to cut myself here because I can go on and on and on.
No, sis, you said that drops, Mike.
I'm just really, I don't know, I'm speechless, but I guess I'm thinking about how you laid it out so clearly as far as like the patterns, the history. When I think about just what you said, as far as like doctors not practicing good medical practice on Black women, not providing anesthesia. Like the first thing that I thought of was in our last episode where Neela said, I was waiting for them to come with the drugs and they never came. And Keisha was like, they were never coming. It's just so wild to me how these like individual stories get wrapped up in a whole pattern. It's just, it's wild.
Mind blowing. So,
I'm sorry. Go ahead.
Oh, no, go ahead. I'm sorry.
Oh, yeah. I was just going to ask this question because, I'll say that question for another time, but going off of what Jackie just said, like, and maybe you could speak to this, Shamika, is one of the things Neela talked about was how they just came in while she was sleeping. She didn't know they was going to do it, and they just broke her water. And she was screaming because she was in so much pain. And they were like, oh, she's just being dramatic. All we did was break her water. and it's like they're not giving drugs, they're breaking water without permission. What do women who are listening, people who are listening, and people who will listen to this podcast, what do you do when that happens? Because they come in with the bullshit, and before I break a neck, let me know if I could do this the legal way.
Right.
Figure out how to get this not to happen, or if it does happen, how then can we, hit them in the pockets, hit them, with a lawsuit, whatever it is we got to do to stop it from happening to other people. Because I don't want to just complain or put it on podcast. What do we need to do? Because that is insane.
Right.
But as soon as I slap somebody, then I get hit with a lawsuit. I get hit with assault charges. And now my kid got to grow up with a father in 10 years. You know what I'm saying? I got a father from behind bars. So what can y'all tell us when things like this, or to keep things like that from happening? Because that just pissed me off.
And I just wanted to add that there were so many examples. Like they were talking about the vaginal exams that they didn't even know were coming. Like there were so many examples where they were like, oh, and the doctor did this and didn't warn me and didn't tell me. And I'm like, what? Who does that?
Right.
I'm saying there's so many examples, but you talk to two people, and I'm not going to discount that that's valuable information. And in total, 4 different birth stories, because one guest had 3, and then Keisha has 1, and she also has her stepchild as well. But can you imagine the stories that have not been recorded, that have not been documented, that have not been told or shared, or don't even know that what happened to them was not supposed to happen?
It was criminal.
Wow.
It was criminal.
It definitely is.
I know Dr. Poetry I feel like she had something to say. So let's go there, and then we can answer John's question.
No, and absolutely. And I'm listening and just being present with everyone's narrative and information. There's a term called obstetric violence. Obstetric violence. It was first coined in Latin America, but it's being studied here as well in North America. Actually, it needs to be a term that is consistent across the Americas and that diaspora. But obstetric violence focuses on what happens in obstetric care is violent to the body, and it doesn't take into account the woman's body or the person's body as a body of agency, a body of autonomy, a body that can speak their own decisions and know what's best for them. So it can even be very subtle as giving someone pain medication when they didn't ask for it, or not giving someone pain medication when they did ask for it. Obstetric violence, when someone comes in and just breaks the water, or give the person Pitocin or something, or a episiotomy when they did request certain requests in their treatment, not informing the birthing person when their birthing plan might change, or wait until the last minute to let them know. I also had a patient, Afro-Latina, she mentioned to me, she did her research. She found an OBGYN who was culturally competent, who was passed all their training in implicit bias and all of that, checked all of the boxes. But what happens is, even that female OBGYN who was of color and could relate to her patient population, that female OBGYN was still susceptible to the institutional racism of that hospital. So what happened is, even if that OBGYN says, my patient requested not to have a C-section, the senior white male doctor, which patterns show there are more of them in these facilities, especially working on women who have high-risk pregnancies, can override that the junior OBGYN's decision. So what happens is there's still a layer of institutional racism, not just for the patient, but for Black female midwives, or Black female nurses, or Black female OBGYNs, who are still susceptible to the institutional arrangements of that particular medical establishment. So this is pervasive and hegemonic and operating at almost every single level of the medical establishment, micro, meso, and macro level, top down and top up, all the way infused throughout. And this is not a broken system. As Dr. David Williams, Harvard professor, this is not a broken system. This is a well-designed system. It is well designed to carry out the intent that it meant to carry out, things like obstetric violence, things like trauma, intergenerational trauma, psychological warfare on the body. There's a book that I wanted to highlight here by Dorothy Roberts, and we can't have a segment like this without talking about Dorothy Roberts, since she's like that.
There it is.
She is what
Yes.
you would be
In the
considered
black
that
body.
queen in this in this arena. And she says here on page 23, right here, that where is it? The social order established by powerful white men was founded on two inseparable ingredients: the dehumanization of Africans on the basis of race, and the control of women's sexuality and reproduction. So for slave women, procreation had little to do with liberty. Black women were not only seen as commodities and property, but they were strategically meant to breed, the enforced slave breeding, to maintain the system of enslavement, which is how we even have a medical establishment, one, and how we even maintain slavery in the South and through. And I feel my grandmother's on this because I hear the thunder and lightning and rolling in the background. So, and to bring up some more examples of this that Midwife Aiyana just mentioned. One, FMLA. So even when you give birth in this country and you're looking for that good old maternal health package, or you're looking for that six weeks window or 8 weeks window to go back to work and paid maternity leave, that's almost non-existent in the US context. This is the highest income country with the worst maternal health outcomes for historically vulnerable populations. The highest income country with the worst maternal health outcomes. That's one. Two, we have the history of eugenics that very few people bring into the conversation, that Black bodies were policed since day one. Black bodies, Blackness, anti-Black racism, or seeing that certain features, phenotypology, all of that is a part of the entire infrastructure at every single level of the scientific enterprise. Three, we talk about residential segregation, and very few people talk about how residential segregation impacts birthing outcomes. What does something like residential segregation, where you buy your house, where you live, where you eat, where you sleep, what does that have to do with birth? Wow. It has everything to do with birth, right? Because oftentimes groups, Black and brown groups, tend to group together or live together, buy property together, rent together in the same types of spaces to congregate. One, for safety. Two, for affordability. And three, for political power. But what happens is, due to residential segregation, redlining, neo Jim Crow laws, Jane Crow laws, if you want to bring that in, what happens is this further separates Black and brown communities from healthcare services. And not just healthcare services, from quality healthcare services. So you're pushed out, or you're on you have a doctor, you have to wait, weeks to get an appointment, or you can't request your own, physician, or when you look at the listing under your Medicaid package or your private insurance package, this person is outside of your coverage. All of this is part of the small designs with racism in mind. And people never think that connects to something like residential segregation. But these are the structural barriers that are put in place, well designed, again, to carry out its agenda since day one. And the last part I was going to mention, in terms of reproductive stratification, there's a term called reproductive stratification. It's kind of coined in sociology, but what happens is, where you tend to encourage white women to give birth and discourage Black women from giving birth. And it happens so subtly at the micro level, you're not even paying attention to it. So reproductive stratification, Black woman gives birth, she comes in for her first appointment, she's excited, and the doctor or the nurse or even admin says, "Oh, are you married? Oh, your child might be this complexion. Or where's the father? You know, even those little subtle implicit biases, meaning her feelings about her pregnancy, she's carrying that with her, not only outside of the clinical encounter, but also within the clinical encounter. And this can impact her allostatic, the way she perceives her body, perceives her pregnancy, perceives her birth. So all of this is happening psychologically at every level. So not only do you have what Du Bois calls this double consciousness, but almost like a triple consciousness, where it's just like I'm not only conscious of my race, I'm not only conscious of my gender and class, but I'm also conscious of the fact that I'm bringing a life into this world. How does it feel to be a problem? Du Bois asks. How does it feel to give birth to the problem? Is what we're asking.
Wow.
And so this point right here is Black women giving birth to problems. What does the agenda say to this? We have to take Black women out the game. And the way we do this is the way I don't say we or they, and how we all kind of sort of are implicitly, trained to be complicit in these agendas, is by not, being trained or to know that this is happening. It's so subtle that we miss it. So it's that's how oppression does a very thorough job. I think in it is the patient's problem, the individual's fault, and we miss the cues that have been there along the way.
We're blamed, going back to John's question, we're blamed for a lot of our own problems, and I think that's already been said, but the things that you will hear within the hospital system are cringeworthy. The things that are done. So simple things as like a cervical exam, we're finding that like instead of asking someone's permission because that is their body, that's their autonomy, that's their right, you find people going in, okay, open up. I have a friend who like details a story about when she was in the midst of labor and contractions, and the doctor says, open up. You don't talk to me like that. This is my body, my experience. And also, I also have to be very transparent, especially when people are coming into the hospital system and wanting to have what we term as a natural labor, but physiological labor, which is like they don't want to come in. They want to come in. They don't want any medications. They just want to let things happen on their own, in a system that's not designed for them to do that. And so I have to tell them, let me let you know, I know where I work. I know and recognize where I work. It's all about checking your biases, checking the fact that you are in this space that is not designed for Black bodies. And so I often have to remind myself, even with some of the things that I had previously said or had done in the past, you have to change those things if you're wanting to really disrupt the system. So there's a lot of things that happen within the system that are cringeworthy and they do not feel good. And I leave some days feeling that trauma in my system. And I've had to work through, within the last couple of years, I've done some serious work in like decompressing and creating rituals so that when I'm in these spaces, I'm not causing myself further harm and then causing my patients further harm either. John, you asked like, what do we need to do? We do have to take on some responsibility for ourselves. Again, keeping in mind that the responsibility is not necessarily ours to take, but because people are not caring for us in the way that we need them to, we do have to step in. And so one of the things, a few things that I mentioned to people is vet your provider. Now, here's the tricky part, as Dr. Pochi had mentioned too, because your insurance dictates where you can go. Sometimes you are only allowed to go to this one person or these few people. So I know that I'm speaking from a place of privilege when I say, don't continue going back to somebody who's going to cause you harm. Some people don't even have that option. Yeah. So like, what do we do? And I'll get to that in a second too, because I have something to tell you about.
Tell us the tea, bro. Tell us the tea.
Thank you.
I can tell you. Well, let's start here. So like people are like, and with COVID and the pandemic, we've seen, a rise in the number of people wanting home births and out of hospital births because it's fear, it's fear based. And that's a whole other tactic as well. And so we've seen that happen, but not everybody can afford a home birth because that usually is out of pocket expense, or from the midwife perspective, when it is supplemented by we call it Medi-Cal. You guys are medicated.
Medi-Cal.
Yeah. So when
Medi-Cal.
we're supplemented with Medi-Cal, their supplements for the care is not nearly even near 50% of the actual cost of birth and prenatal care. And then if the patient has to transfer to a hospital, you can forget getting your money for that care. How do you sustain midwifery if you do not get paid?
What is Medi-Cal? I have never heard of that before.
Medi-Cal is the equivalent.
It's the equivalent to Medicare.
I think it's the Cali version, probably.
Yeah.
Oh, okay.
Yeah, so
Okay.
Medicare,
Yeah, Medicare.
Medicare.
Medicaid.
So, yes. So that's the equivalent there. So, I mean, you know, government funding is not going to cover midwifery care outside of the hospital. That's a tactic. So just as much as people are planning for their vacations, they're planning for their wedding in their homes, you need to plan for birth. And this is what is like my driving force, and something that I try to promote very often and is very, very important to me. We need to start speaking about birth with our young queens and kings at a young age, because not only is birth this and pregnancy this transformative experience, we have people who are walking into it unexpectedly and don't know what is happening downstairs or with their genitals. Like, I've sat in the Vagina Chronicles. It grew because I kept sitting in front of people who knew nothing about their body, but had a full baby come out of it. So what are you then teaching your child if you know nothing about yourself? So it's very important that we start from a young age talking about these things. And I appreciate Keisha, because she was going into like what she's been telling her children. Both of your guests were talking about, like, you know, what they need to know, what's going on with their bodies. It's super important. But I'm a firm believer in that. And in addition, postpartum is like the forgotten time period, which is one of the most crucial times. And I'm not talking about, and just to clarify, because people think when you say postpartum, they're referring to depression. I'm referring to the time after the baby is born and the rest of your life, because postpartum is the rest of your life. But
look, reframe it. Yeah, get us to redefine, reimagine this. I love that. Everything afterwards is postpartum. I never thought about that.
Until your dying breath, or God forbid your child's
All of
dying
that is postpartum.
you are in postpartum. You have now adapted this role change. You are, I love Dr. Poetry when you said you had your baby, you're celebrating your birthday too, because a person who is having a baby, no matter what that looks like, is being reborn. And that is this huge, impactful thing. People are taking this like for granted. Birth is not just this fly-by-night thing. If you are paying attention, you are at the portal between life and death. People, if you look at somebody who is like, you know, this is my experience, even people who are medicated, but if you are looking at somebody who is in this transformative or transitional period, when they're about to have their baby, they're usually saying to us, take the baby out. And I'm like, you got to do it. And when you look in their eyes, you are going to see someone who is not the same person when they walked in that door. You are seeing someone the very transformation happened then, and they are leaning into you with eye contact if their eyes are open, for support, because they are going through something outer body experience. It is happening. So bringing it all back, I've gotten better at that, guys. So I go off on tangent. Very good. Back in.
Yeah. Keep going. Keep going.
So what's important is early education about pregnancy and postpartum and our bodies. That's the super important part. So not just like what happens when you have a baby, but like all the other components as well. The other thing too is having someone in the room to support you. I heard the young lady, forgive me, I keep forgetting her name. What is her name? Neela, forgive me, Neela. I heard your story, I heard it loudly. I heard your stories, and doing a procedure without informing you of the risks, the benefits, and the indications, and then your verbal consent or written consent, depending on what the procedure is. that is a violation, as Keisha mentioned, of your human rights. So the reason why I bring up doulas, it has already been studied and proven that doulas and midwifery care can reduce the rates of unnecessary C-section.
Right.
They also are there to be an advocate for people when perhaps they can't advocate for themselves, or maybe their advocacy has stopped for whatever reason. So it's so funny, you know, like John, you were like, what do I do? You can always take a moment, like if someone says coming in like, you know, we need to do X, Y, and Z, and we need to do it now. There's always a moment, and the doulas love to do this. They're like, can we pray about it? You know,
Right.
and that is a tactic, because it's not necessarily that you're gonna pray. It's that the answer to your question is, this does not have to be done right now. If you're paying attention, this doesn't have to be done right now.
Let's pray
So
about
a doula, and that's not just what they do. Doulas do a whole wide variety of things. They are non-medical supportive people who are coming in to help you with your pregnancy care. So they're not going to deliver your baby, although that has happened, but that's a whole other topic. They're not going to deliver your baby, but they're going to be there to support you, or be with you at your birthday baby. They'll be there to support you along each stage. Postpartum, they're, you know, if you find an excellent doula, they are cooking meals for you, or they have that set up so that it's done for you. They're there to like help you with breastfeeding, lactation, pregnancy positioning, so that you're like getting more comfortable during that time. But that is another way, it's another piece of armor. I've been using this term myself now lately. We need to armor up, because they're just coming for us and we're coming defenseless pretty much into certain spaces. This is part of the armor that you need, is someone who's going to be watching. That's another part. Watch what's happening. Ask the questions. If someone's annoyed, that's too bad. It's my body.
Say it again.
It's
Say
my
it again.
and it's my experience. And what's I'm gonna bring in the white perspective of it too. It's not just Black people having these obstetrical violent experiences. There are white people that their experiences have been traumatic as well. That's again a whole other topic. But what we need to start doing as a medical profession, in my opinion, is honoring the experience that's happening before us. This is not just a one and done journey. Like, this is not just like pop a baby out. This is like someone's carefully planned, hopefully, and curated experience. And while no, it doesn't always look like how we want it to, we can at least take the time to like recognize and say, I hear what you're looking for. This is what we can do. This is where I'm going to meet you. And it's really about honoring the fact that someone sitting in front of you is human. You know, this is not for no reason, right? The person in front of you is a human person coming to you for a human need, not a Black need, not a white need, like a human need. So like, let's honor that. And then going beyond that, you've destroyed many things for Black people. So it's time for you to give back and to really pour into them. The statement that I wanted to make before, it's like, how do we get out of these spaces, or how do we, you know, have an opportunity to survive these spaces? I'm going to put some perspective here. There are 384-ish birth centers, or centers where people can have their babies, that are not hospitals and not the home. So kind of like a middle ground. Freestanding birth centers in the United States. There are 12 that are owned by Black people. Do the math. So, and I can give you information on the foundations that are trying to change this. There's a Birth Center Equity Foundation, which is trying to change that. Jenny Joseph, she's a midwife as well, who has her own school, Common Sense Midwifery. I'm just gonna be transparent, because I've been trying to like manifest this for the last 5 years. I will have my own birth center.
Yes, you will. Yes, you will. Come on now.
How much money you need? I got
5 on it.
I got $14 in my pocket. I got you.
5 on it.
Like,
and say, now's the time. Like, now's not the time. Not yet. Give me a minute. But when I come to you and say this, and because people, you know, I speak a lot, I talk a lot with people, and they'll say, well, where can we donate? Give me a second.
Bro,
But
I'm dead ass.
when I do come, please come with your coins, because the financial aspect, again, Dr. Poetry mentioned this as well. The financial aspect is we need funding too. We need diversity in medicine. We need diversity in midwifery. Yes, but there's money. Like, we can't thrive without some of the funds. And again, that's tactical. So those are my armor points. I'm going to stop talking so other people can talk.
No, you good.
Let's go to Dr. Poetry. I feel like I'm so glad that you used that metaphor of armor again, saying armor up, because that's exactly what Dr. Poetry was talking about, saying we at war. So let's hear your war tactics. What's in the artillery? What's the ammunition? Let's go.
Well, first and foremost, I know we talked about solutions. Nina Simone, she has a quote where she's like, I'm not the doctor to cure this. I'm the doctor to expose this. And we cannot cure anything until it's exposed. So I am the doctor to expose this. I'm not here to bring solutions. I don't give advice. John already know. People hit me up, what should I do? I'm like, what we need to do, or what has helped for me, is to learn how to listen. Learn how to listen to our bodies, learn how to reclaim our bodies as sites of power, learn how to listen to summon in help and power from the grandmothers, the foremothers, the aunts, the uncles, whomever, long before us, the ancestral realm. So for me, I think it's more holistic. Mind, body, and spirit needs to be channeled and brought back together. As people, we have always respected those three tiers. We have always respected the land, the spirit, the ancestral realm. Like, we've always brought that to our care work. It is only in this country where it's been dichotomized and kind of split in half. And so now I think if there is a solution, is to get back to that. It's to get back to that listening, that voice you hear within, like, this ain't right. Something is not going on here. I need to get a second opinion. And a midwife Aiyana just mentioned here, I don't want to privilege, some women who don't have that option due to their insurance status. But actually, for example, I have a patient, she couldn't get a second opinion because it was too expensive. So she had to go with the first opinion of her physician. And oftentimes when women don't follow the stipulations of their physicians, so to speak, they are sanctioned. And these sanctions are detrimental to Black and brown bodies, because these sanctions often mean that a social worker is going to have to follow you home. Someone's going to have to check in on your pregnancy or your birth or your postpartum, come to your home to make sure you're a fit parent, a fit mother. So these sanctions are very criminal. They criminalize Black bodies. And so I think if there is a solution, it is for us to master the gift of information, to get more information, to not be apologetic about wanting more information. Malcolm X says this perfectly well. This is not me being, I'm paraphrasing here. It's not me being in my feelings. It's me having emotional intelligence. Emotional intelligence by asking more questions. Midwifery is so interesting. I really wish I would have had a midwife. Looking back on it, I was 23 years old. My body knew something was happening. I knew what was going on. I would wake up at 4 a.m. in the spiritual hour to pray, to meditate over my belly. I knew that there was something going on in my womb. I didn't have the language, the permission slips to say, yes, you can do this, or no, you don't have to do this. So looking back on it in hindsight, I really wish I would have learned what I knew now, or listened more to my body, to my grandmothers, to the foremothers before me. At the time when I was giving birth at 23, these physicians were coming in telling me I had to get an epidural, telling me I only had a certain window slot to do so. All of that is a part, that rush to make a clinical decision is detrimental to your body. It's detrimental to your mind, body, spirit, and it's detrimental to your postpartum thereafter, because now you're reflecting and you're thinking, did I do something wrong? Did I say something wrong? Am I responsible for my birthing outcome, my birthing experience? When really it's an integral part of the structural powers that be that impact your birthing experience and your birthing process. So I definitely think getting more information, listening to these stories, telling your story, there's power in telling the story in whatever way that the story manifests is so much more important. And that these are action steps in the right direction. Some people often say, I'm not all about talk, I'm about listening, or I'm not all about talk, I'm about action. But we forget that telling birth stories is action work too.
Yes.
Telling birth stories is action work. That is a revolution when you could tell your story and tell it well, when you could be in public and breastfeed and not give a damn, where you could say, I really want a doula or a midwife. I want to know what this means for me. Can I get more information? I think that is the sermon. And so I don't want to offer solutions. I want to offer tools of war to sharpen your tools. Iron sharpens iron, with leaning in more to your story, leaning in more to the women before you, and listening to the Black body. I would like to shout out definitely some midwives that I know in South Miami, Southern Birth Justice, midwife Jamara, also the Gathering Place. These are all Black women owned.
Yes.
They actually just had their very first Black Maternal Health Week in Miami-Dade County. So shout out to 305 holding it down, the Grassroots Collective. Please do not underestimate the power of the grassroots level. So these women have supported my process to send me patients with birthing stories so that I can collect stories for my dissertation. So I try my best to give back, give shout outs as much as possible. Also spiritual midwifery. Sheila, she's a midwife. She focuses on the spirit. So it's just bringing in those aspects of spiritual care into the birthing process. It's so very important. My last point in regards to postpartum, I really love that, sis, you said it is all the way up until you die. I see that. I honor that. I want to give name to Erica Gardner, who is the daughter of Eric Gardner, and she was, I'll say killed, but they say she died after, I believe it was a few months or so after she gave birth. But she experienced so much stress and chronic stress and trauma to her body after her father, Eric Gardner, was killed from the I Can't Breathe traumatic assassination, because that's what it was. She lost her life. And that is an act of postpartum death. I think people don't attribute her death to postpartum. They just say she died, you know. But I think that has a lot to do with what's happening in the streets, what's happening in police brutality, on the killings of unarmed Black persons around the world impacts how we conceive. It impacts how we process prenatal care, how we process pregnancy, and all of that is funneled through the through the womb on our bodies. So I definitely want to shout out those names of women who are losing their lives, but it's unreported as postpartum.
It's true. It's funny. Well, not funny you say it, but ironic you say it, because we talk about the Black maternal health crisis and give a lot of light or attention to pregnancy, but we're talking about maternity, morbidity, mortality, and this spans into the postpartum time frame, which we say is like the first 40 days, but we know again, postpartum is the rest of your life. And yes, Eric Gardner, was killed or died, however you want to interpret that, within her postpartum time frame. And that brings up the topic of like weathering, what this continued stress does to our bodies as Black people. We look wonderful, we don't crack, as we say, right? But on the inside and on the cellular level, we are decomposing at a higher rate than again most other people. And so during postpartum or the postpartum time frame, you are at a highly susceptible rate to like heart heart conditions or like throwing like a blood clot because your blood volume has shifted and you're no longer supplying the uterus and the baby. So like you took on this new blood volume to supply your baby, offer it nutrients, oxygen, all of these things, and that placenta in the uterus. But then, you know, once the baby is out, placenta is removed, your body has to adjust. It's like this shift that has to happen. So that's why we see things happen with mood and different mood disorders. Yes. And baby blues, which, you know, that could be like the normal ups and downs. But this is also why we're more susceptible to things happening in this time period. And if we're not careful, like people can, you know, preeclampsia is associated with pregnancy. This can happen after you have the baby too. So high blood pressure can happen too. I wanted to go back to something that was said as well, which was like there's healing and sharing our stories, which is so powerful. But making sure people know that there are many realms to action. And so what I love about Black Maternal Health Week, which like the Black Mamas Matter Alliance has like put into play, and it's now on its like 3rd or 4th year, maybe more than that.
Right. 4th, yep.
Year. So what they put into play is showing that there are different levels of action. So there's fundraising, there's policy change, there's grassroots, like you talked about, there's sharing of your stories, there's people who are in research. We need to, again, remember, people were doing research on us for the benefit of white folks, not the benefit of us. So what needs to happen now is that research is done for us, by us, and then told back to us. The results are shown back to us so that we can make changes in our community for the effect of ourselves. So, and then midwifery work, doula work, birth work, work within the medical system. We do have some amazing and fantastic MDs who are really trying to affect change as well. I want to say this point too, you know, like people, another tactic people are using or part of the armor is like finding someone who looks like you. However, that's not always a saving grace.
Right, exactly.
I want people to be very cautious again. And just on the other side too, there are white people who have helped Black people through their own birth experience and possibly saved lives. This is truth. So I always mix this up, but not all skin folk are kinfolk is what I like to say. You know, at the end of the day, you have to ask these questions. It's not just Keisha did a really good job about explaining what she did. She's like, she asked like, I want to know what this provider does. This is what my plan is. And if I don't care for it, I'm going to somebody else. You know, again, a privilege, but if you're able to do so, you know, making your movement or your way around, you get to consult. A conversation is not a commitment. I'm learning that at age 30 something. Is not a commitment. It's just a conversation. That's what a consult is. Consult with somebody to determine if you actually like them. Stop pulling down your drawers for people you don't like. That's
right. And that go into a whole nother conversation. There's some intersectionality in there.
Oh Lord, nah, you a trip.
But again, preparedness. Like if we're preparing our young Black girls who, time and time again, because I'll never forget, I used to be in front of the mirror, y'all. Now I barely look, right? So I used to be in front of the mirror all the time, comb out my hair, and what did my mom say? Get out that mirror. You know, time and time again, we have these young Black girls who are told that they're too fast, get out the mirror, they're doing too much, and they're silenced. And then when they grow up, we're expecting them to like hold space for a baby and a child and sex and intimacy. And we have not been given the tools to do so. And we, again, no, we're not placing blame per se, because your parents are human too, and they did the best that they could with what they have. But like, we now have to relearn and unlearn some things that have been so caustic to our femininity or our feminism, and how we want to view ourselves. Like, you know, if you've been told you're too fast, you could go either direction. Some people will lean into that and some people will shy away, and then they just don't know anything about their bodies. It's so important and critical that we're talking about these things now so that you aren't dropping your jaws for just anybody all the time. Like, if we understood the power that was between our legs, like the revolution is coming through the Black woman, not nobody else. Okay. So That's
It.
that's all. That's all. Mary had a little lamb.
Right. There's an aspect I wanted to mention when you talked about victimization. There's a term called poly-victimization, and is often used in domestic violence or women who have experienced abuse. Rarely applied to pregnancy, but I really believe that there's a strong link. Poly-victimization, where you looked at the intergenerational components of being victimized over time and what this does to the psychology, the psyche of women over time. So just looking at if your mother experienced trauma, and so many of us know that the generation before us experienced so much trauma from their mothers, and their mothers from these enslaved plantations, these lands who they internalized the memory or the harm, the violence, the death, the assassinations on their bodies, the rape, the sexual abuse, the assault, having their children ripped from their arms, giving birth, and being breeded. All of this passed through the fiber of the birthing and the memory of the birth canal. So you might be experiencing memories from your own families that you did not create yourself. You remember something happening to your mother or something happening to your foremothers, and you carry that memory. Us as melanated people, we are the first complexion, which also means we hold the most memory. We hold the most genetic DNA memory in our fiber in our cells. So when you have those dreams, those inclinations, those manifestations of memory, all of that's passed down intergenerationally. Victimization intergenerationally, abuse intergenerationally. So when we proclaim our rights to tell our stories, this is an act of power. I know that these are multiple levels of action, but telling the story, I think telling that narrative is the very first power, especially for people who are oral culture. It is the way we hold memory, hold space, and share power, sharpen our tools to fight these wars. It's not going to be in silence. Our silence will not save us, as R.G. Lord so plainly states it. And so I just wanted to talk about that aspect. Also, the second thing I wanted to mention is that Indigenous women of the diaspora, we came up with these frameworks. These frameworks are ours. Those strategies, these wellness strategies, these action steps that we're taking, we created them. They passed down intergenerationally for us. These are seeds that were planted in us to continue to proclaim and exclaim. What's happening is white women are now having access to these strategies at higher rates than we do. So even like midwifery, where you had granny midwives in the South, Black women had to rely on their lay knowledge frameworks because they were excluded from medical institutions. So they relied on midwives to save lives, to give birth on, and on the land and in plantations. But what happens is now you see a flip where you see white women having more access to doulas, more access to midwifery. They know these strategies better than Black women know. So it's really interesting how now there's a resurgence, but you have to look at the time point in history when certain groups have certain access to, wellness strategies for what and how does this play a part of the agenda that is well designed to continue pervasive and perpetuate oppression. All of that is a part of the plan. And in regards to that, I wanted to mention something about women who are young giving birth. I want to shine light on teenage moms and young moms, because so often, especially in brown and Black communities, we often police women when they're not married for being fast, for having a womanly knowing about their bodies, even at 16, 13, 10, whatever, for exploring themselves, for so-called being grown. I believe Bell Hooks talks about this in Womanish. But, I want to shine light on our teen moms that are often left out of the conversation. And even as a young mom myself, I wasn't married when I had my child. I eloped thereafter, and a part of me felt like we were coerced to get married. But it is a very personal trauma that came with that for me that many people don't know, and I'm being vulnerable on this podcast. But I would say as a young mom who gave birth, I wasn't given the same light as a married woman who got married first and gave birth. And that does a different type of trauma to a woman's body when there's religion involved, there's abuse involved from other women, there's a policing that's involved, and then there's damage that you're never beautiful, or you're never like seen as valuable because you opened your leg so young. So I want to tell mothers who've experienced that your marital status, your relationship status does not define your motherhood. And your children need to see a happy woman rather than just a married woman. And so one of the reasons why I divorced.
Say that again.
Your children need to see a happy woman and not just a married woman. That is not, they're not the same thing. So when I got my permission slip from my child, from my womb, to say, you don't have to be married to be a great mother. There are women before you who've done it, and there are women after you who've done it. And so you could be dope all by yourself and with your community help. As a matter of fact, I don't say I'm a single mom, I'm a village mom, because I uphold villages and villages uphold me and my child, and we all work together in synergy. So I just want to shine light on that. When I was in South Africa, I actually went to South Africa for 6 months back, way before I had my daughter. And this sentence came to me from one of the village moms, and it kind of came back to surface as I was raising my daughter. The sentence says, "The woman with the child has the most wisdom." The woman with the child has the most wisdom. And that will always come to me. And I used to always wonder, why does she say that? It's an African proverb. African proverbs, people say them, but they hit you right when you need them, And that one hit me along the way of raising my daughter, because I didn't feel like I had wisdom at 23. People telling you what to think, what to do, what to dress the baby like. And I saw this onesie that said, my mom doesn't need your fucking advice. And so I was like, please, just, we good, So, but that proverb gave me the strength I needed to be a young mom with wisdom. A young mom who has, things to say, a young mom who could say no, a young mom could say, no, I don't feed my child that. We don't eat this, or we don't go over there, or we are free. We could travel. We are going to go wherever we want, So I've learned to set myself free using the wisdom of the African proverbs that I felt were coming back to me to proclaim that, whether I'm 23, whether I was 16, whether I'm 65, whatever age you are, you have a particular set of wisdoms that are assigned to you. And it is your human right and your birthright to proclaim those and to lean in toward them. They're there for you. So I just wanted to shine some light on the young moms, to trust their bodies and to know that you're the queen, you're the boss, you're the goddess. And that doesn't mean that you have to be policed by religion, by marriage, or by anybody else's opinion. Period.
I just appreciate everything that both of you have just just like poured out onto us just now. I am so blown away. I have so many questions, and I know that we are like so out of time, and I'm just thinking like, we just have to continue this conversation. It's just so crucial. I think where we are right now, I'm just thinking as we are about to close, before we get to our takeout box section, I think practically speaking, what would be next steps for anyone who is either pregnant, about to be pregnant, thinking about having a baby? I feel like it became quickly clear that this is so much more than just maternal health. It's like, it's just health, period. It's women's health. And so I'm not even sure what question it is, besides from both of your perspectives, what are like, if a woman or a young girl is listening to this podcast right now, what are the like next 3 things that you would want her to do after hearing this conversation? And if you can't get 3, just what's the next one thing? Actually, let's just say, what's the next one thing? What's the just, if she does nothing else after she listens to this conversation, what is one thing you would suggest for her to do? And then we'll go into the takeout boxes.
Oh, I'm muted. I just realized that. Dr. Poetry, you want to go ahead?
Thank you, sis. I would say my first thing, this book gives so much courage. The title, I think, is fitting for what this means. This Queen Sister Sonia Renee Taylor, the author, I speak her name. The book is called The Body is Not an Apology. Your body is not an apology. And so many times we're apologizing for stuff that doesn't belong to us. We're apologizing for being too big, too small, too big, too this, too that, too can't, too pregnant, can't get pregnant. We're apologizing as though our bodies, are doing something wrong. So if there's one thing I would say, which hasn't even got to the step of prenatal care or primary care, is to know that you do not have to apologize for what your body does or for what your body does not do. That's step one. That's about radical self-love.
Wow.
I think, exploration is key. I definitely agree with that. You said three things, and so my brain is like rattling off like all the things that like need to be done.
That's what I was like, maybe just one, because it might be hard. So whatever works.
So I think taking initiative for self-learning and understanding. It's really important to understand what your body does. So like I think that's like a wonderful pairing. Like it's not an apology. Let's learn what it does. And there's a few things that you can kind of do out there, but knowing like how your system works and I remember as a child, like my mom and I, as we're talking about like the menstrual cycle, we sat down like, let's go to the library. So in conjunction with learning about your body, find someone who is safe and maybe appropriate to take you on that journey as well. It could be like a good girlfriend, it could be your parents, it could be it could be your midwife. Take somebody on that journey with you so that like when you have questions and maybe somebody who might be like in an elder type of position, I feel like that's beneficial. Again, safe person, so and people have to kind of know their circle to know who they can trust for that. But we really should, I am a firm believer in the village. We really should have people within the community. And this goes down to like even periods. We didn't even get to talk about that, but like when that happens, it should be a celebration. Like, they're, if we're looking biblically, they had a special tent where they went, where they when they had their cycles, like, and I don't think they were just sitting there in misery, like they're kiki and haha and telling stories and letting them know like, yo, when your wedding night happens or whatever, this is what's about to go down, like, so that their young girls were prepared. So again, finding like that village to take you on that journey. And then so you're talking about like, what should I do, what are the next steps? Find a good doula, like just really find somebody who can take you on that journey if that's where you're going. But like, it's never too late to learn about what's about to happen during pregnancy and postpartum, et cetera, with your body. So start now. I really am like, even if you're 20 and not planning on having children for another 10 years, learn now so that when you get to that place, you can remember and then reflect back so that you're prepared for this journey ahead. It's Preparation is key. It's so key.
Yo, I'm full. And look, and this is what we do when we full here on Street Academy Podcast.
So
We get our takeout boxes, right? We get our takeout boxes, the things that we could, that we still digesting, and those things that we gonna have to go home, go back to our places of solitude and just consume even further. We ask our guests and we as the host talk about what we took away just from this meal and just from everything that you all have just blessed us with. One thing I would love for either Dr. Poetry or Midwife Aiyana to talk about is the difference between a doula and a midwife. So when we get to, when y'all do y'all takeout box, if one of y'all could just throw that in there. I know for me, my takeout box. I have a daughter, right? And there's a I'm learning so much because a lot of times as a dad, I'm like, all right, well, she has a mother who could tell her all these things. And so this ain't really, I don't really need to know this stuff, everything about the Vagina Chronicles. I have been to the Vagina Chronicles a few times just to support, you know what I'm saying? Not really,
Probably been in a
but
vagina. Sorry.
yeah.
I think you need to know the Vagina Chronicles.
Yeah, but
Okay, anyway, sorry.
yeah, on many different levels, not just on the sexual level, you know what I'm saying? But
Exactly.
yeah, but just in general, like men do need to know, you know what I'm saying?
Right.
And so I just find myself being so empowered by this conversation because at some point when my daughter does get older and when she's talking to me, I could be able to tell her, yeah, you can go to your mother and you can go to your auntie or whoever to talk about this, but daddy could tell you some things too. You know what I'm saying? And I feel like that'll even bring us, even closer together. You know what I'm saying? And then not only that, but I do think that there are spaces, there are sacred spaces in this conversation that do belong, that should be transferred from a woman to a girl, from a woman to a woman. So I respect that part as well. So I feel like there's space for both me as the father and then me giving her, like what Dr. Poetry said, to the village of women who can then have a much deeper conversation about these things. So I'm grateful for you all, and to the brothers listening. Hey, these are important conversations, especially if you have a
Yes.
daughter, especially if you have, a younger woman in your life, a niece, or
Nieces.
you right, or whoever, you know what I'm saying, or just young girls in the community. We could be having these conversations, man, and just empowering us to, just to continue to do the best that we can to, help raise full, healthy, whole Black women. So,
Right.
so I,
Ashe.
I thank y'all sisters for that.
Yes. I would are we allowed to say something else?
Yes.
Okay.
Yeah,
I was
so
gonna
everybody's gonna do like maybe like a
okay.
2-minute takeout box. So
Okay.
yeah, just 2 minutes. Take what whatever you take away from this conversation. We'll go to Dr. Poetry. We'll go to Jackie. We'll go to Aiyana, and then we'll end with Amber.
Okay. Um, okay. So my takeout box, I was gonna play a little bit of the Chakra Bowl for the listeners. I do value wellness, and I do believe that one approach to the mind, body, soul care of pregnancy and birth and postpartum is to instill all of the tools of wellness that work for you. And one that works for me is to have affirmations or to have mantras. Some of my mantras I get from Sacred Woman, Queen Afua. And on page 62, she has a few mantras for the womb. So her top two that I say for the listeners, my womb is sacred and so is my life. My womb is precious and so is my life. My womb is divine and so is my life. So that's my takeaway. I'm gonna play a little bit of chakra bowl music. And so take your mind, body, spirit with you wherever you go. You are your first knowing. Ashe.
And I just appreciate y'all so much. I appreciate the tone and the energy that y'all have brought into the space. And one of the things that just keeps sitting with me, I don't know. I mean, I'm kind of not kind of. I'm quoting Oprah because when she did that interview, she asked that question that I think people just continue to sit with. Were you silent or were you silenced? And I think about how you all have said over and over that folks were silenced from sharing their stories in different ways. And so it's really important for us to listen and to like be attentive to the experiences of other women and other birthing people, to share our stories and to not be silent or to not be silenced. So I really appreciate y'all for bringing that to like the forefront into my consciousness.
Ashe. Thank you, Queen Jackie.
So takeout box. I want to. Well, I'll say this one. I have a lot, but I'm gonna reel myself in. John, the Vagina Chronicles is for everybody. And while I have a majority, female led or people who have vaginas led population, it is a space where someone can go get info that is relatable and then take that wherever they want to go. I do have people who identify as men who are there, and some of us have conversation and they just are like, wow, but it is for everybody, and it's important not just for people who are who have children or siblings, but like your partner too. Like if you plan to have a partnership with someone with a vagina, I think these are very important topics to talk about. If you can understand the basics, you can understand the ramifications later on. The other two more points, because I'm gonna do three. I'm good with threes. So the second point is we have operated out of a sense of fear for way too long, and I don't want people to walk into spaces that were not designed for them or operate in a sense of fear, or with fear being the leader of their life, or their path, because that's not how we operate. Like, that's not for us. Fear was used, again, tactics to break us down, to break apart our family, to make us think that we were less than, to make us think that we couldn't get the education that we needed. But that has to stop. And so no longer should we practice out of a fear-based approach, but out of a knowledge-based approach, and out of a village-based approach. That's super important. And the last thing that I want to say to you, because a lot of Black people who are having babies have heard this, the phrase 3 to 4 times more likely to die, over and over and over. And while it's important to share that, we also need to give them a level of protection as well. Black birth, successful Black birth can and does happen. I've witnessed it over and over and over again. It can and does happen. We just need to fortify ourselves, armor ourselves, and get us the village that we need. But Black birth is successful. It happens. And when it does happen, the last Black birth I was at, I was like in tears. These people, they were singing at the end. I was like, you guys, I have to be able to see what I'm doing. I wear goggles, again, COVID, all that stuff. So like they're singing up and I'm like, you gotta be kidding me. Like, but they're like singing and I'm like, oh, like, okay, don't go there. But also letting myself be emotional too, because that's important as well. But Black birth is successful. And it can and does happen. So let's remember that just as much as there are these horrible statistics, like walk with this knowledge that you can be successful at your birth.
Yes. And while you're at it, sis, go ahead and the question of midwifery and doulas. Yes.
A midwife versus a doula. So a midwife is a medical provider. We have gone to school for training so that we can, or we've had an apprenticeship so that we can then offer services. Like, we are there for your birth to actually help you with your baby. The term delivered, I'm really trying to get that out of my language, because that's not what I'm doing. I'm not your savior. There are some instances where saving is necessary, but like, I'm not your savior. You are actually the one doing your own saving. So I'm to attend your birth.
Rewind. Rewind. No, you are doing your own.
I'm not your savior. A lot of times at birth, we are relinquishing control, because if we control too much, then we have bad outcomes. So, we attend births, we offer contraception care, abortion care, just like I mentioned before. A doula, the doula is someone who is supportive. That this is not necessarily a medical provider. They're not offering medical service, but they're helping you through your medical journey. So there are all types of doulas. There are end of life doulas. There are specifically postpartum doulas. There are sex doulas. There are pregnancy doulas. So these are people who are walking with someone in their journey to support them along their way. What's wonderful about a doula is, like, again, great doulas will get you, like, if in your early stage of labor, into positioning, help you with managing the pain. They are like getting the partner involved, if there's partner or family involved. So it's like a team effort. Again, setting up for you things that you need postpartum and doing that early and not like late. And then like there's a bunch of wonderful doulas out there too. So another one that I know of, she helps people specifically for those who have lost babies before, and this is their next pregnancy. Can you imagine the journey that takes to say, I'm now carrying a baby?
I know.
After a loss, that's huge. So like they help them through that time as well. So it's physical, it's all just like Dr. Poetry said, it's physical, it's mental, emotional, spiritual, it's all interconnected. It's not just one part of us. So we need more than one person to kind of help us through these journeys. And
Absolutely.
we're hands-on, helping, we use our hands and our hearts to help you get through your journey of pregnancy and safely and effectively. And then we refer when it's no longer appropriate for us to do that. Like if there's something that's higher level of care that's necessary, I will talk to my doctor, or I'll say I'm going to co-manage with my physician because now we're at another level. But I hope that's helpful with the differences between a midwife and a doula.
I encourage all the patients that I work with, and I'm not a physician, I am a medical sociologist, so just putting that out there. But I work with patient populations, but I encourage all my patients to get doulas. If it's affordable, if you can. Shout out to my brother, he's also having a child. He said he need a doula for the rest of his life. So like he said,
brother's so wild.
Where the doulas at for your brother? So
I need a doula for your regular life.
So he always makes me laugh. So when I tell my doula friends what he said, they just start laughing too. So I just, advocate for Black midwives and for Black doulas as well. Across the board.
Yo, my takeout box, I need one of those. Like, I'm coming to the thing with, like, I want the container that the mac and cheese came in, like that whole thing.
You want the pan. You want the takeout pan.
Right. The whole pan. With the fire underneath too. The fire underneath. And the burners too.
I'm taking the burners. I'm taking the pan. I'm taking that little silver thing that is sitting.
Yeah. Let me get the lid too. Let me get the lid.
All of it. I have so much in there. So many questions that I have. When you all were, oh my God, just connecting it back to just being on this American soil as a Black woman and what it meant to birth in the beginning, like what the majority of our foremothers were experiencing about birth on this particular soil, and how that played into sexuality, how that played into religion, how there's control there. It's just so many different things that are intersecting that I'm just kind of blown away by it all. And then thinking about the medical establishment and where it came from, and thinking about the question that you posed, Dr. Poetry, about like, what do you do when you're birthing the problem? And it's just like, yo, the weight of that, when it's just like, I'm giving life to what the problem is in this particular space, that blows me away. And I started off the conversation encouraged and excited, and then I went like down into the depths of despair. I think I'm coming back because it's like how all of y'all were like, we're in war and stuff. I'm like, yeah, we are in a war. And then, but I was like encouraged. And so now I just feel like, yo, I don't even know. Like, yeah, I just got a lot to eat, and I got a lot to eat for a while. And I will be eating. And I already have that book in my Amazon cart right now. I know Amazon is a problem, and yet I need this book as quick as possible. So it's coming in 2 days. So there's that. I'm a part of that establishment. We break one thing apart at a time. I could go up and talk about that, but I won't. But something that you talked about too, you mentioned allostatic load, and that's the amount of stress that we all carry. And I just know for me, I feel the stress in my body. And just from the pandemic, the stress is like, and it's just like, I have gained weight in different ways, in different places I don't want to gain weight in. It's everywhere. And I'm just like, there's so much stress, even from this pandemic. I just feel like, I'm envisioning from this conversation, like some type of community or village or connection for Black women post-pandemic, because I feel like on top of everything that we have already, like we're already holding, this pandemic has done a number on us in a lot of ways. And I'm like, we need to come together and purge. We need a retreat or something. Like seriously, like we, like through these conversations, there's healing. And I'm just like, how can we all get together and do some like release, because it's a lot. It's a whole lot. And I'm like, I can't do it by myself. I'm beginning to feel more and more like, yo, it feels too heavy to do by myself. It feels too heavy to even be alone trying to heal myself by myself. I know it's possible. I know I can do all my little meditation stuff, but it's like, I need some people around. Community. I need some community. So I feel like that's a part of, maybe that's why I have a pen, because I'm about to be feeding other people too. So it's just like, I'm like walking away like, yo, I need this. The village is so important right now. So that's my takeout pan.
I love it.
And John, you can close us out with like what we typically do. Thank you all so much.
Thank you. Thank you
all
so much.
Thank
There's
you.
so much love on this call, so much vibration. Woo.
This
Erykah Badu is a doula, by the way. So like
Baduism, fat belly.
Yes, come on.
Yeah, she is.
Listen,
yo, thank y'all, man. Just again, I'm full. I really believe that all minds and hearts are clear. I could feel the clarity, I could feel the sincerity. And I feel that we are at war, but I feel that we also have been well equipped, well informed. We've been given the tools, we've been given the weapons to continue this fight, to continue this struggle. And so for those who want to continue to be informed and continue to be educated by what it is that you queens bring and the work that you all are doing, just tell the people where they can find you, any information that you want to provide, anything that you got going on. Let us know. Aiyana, I know you building an empire, a birth and revolution empire. I know it's in the works right now. I know you building it, but let us in on that groundwork. Let us in on that foundation. So anything you want to tell us, same thing with you, Dr. Poetry. So go ahead and do that before we close out.
Sure. So for anyone who wants to find me, I'm on Instagram mainly at the Vagina Chronicles. I also have a website which I send out a monthly newsletter to people who are subscribed. So that's www.thevaginaChronicles.org. I'm not a .com.
Hey,
it was taken.
So don't play with her. Who you playing with?
Right. I love how she did like this.
You
know, Black women, we got the
right. Quit playing with me. Stop playing.
You gotta lean into it.
That's where things are right now. We completed a postpartum prep group specific for Black pregnant moms. My friend and myself, Kenina Bourne, she's of Reborn Wellness. She's a licensed clinical therapist. And we just did a postpartum prep group that was like pivotal. And so knowing that they're equipped for this is like just so heartwarming. And even if their plans don't go as planned, like they have the resources to manage that. So we'll probably be doing another group sometime later in the year. So if people want to follow, that'll be on our webpage or my webpage. Another thing is I was recently featured in Oh Sis, You're Pregnant by Shanicia Boswell. She did Black Moms Blog. She is the founder of that. And so chapter 21, I talk about postpartum depression.
Come on, chapter.
My dog, that's my
Check me out there. And then another thing that I'm celebrating and learning how to celebrate, I was recently featured in Essence magazine. There are 9 Black midwives and doulas you should know. And one of them had no clue it was happening. So I am like celebrating, letting people know there are so many Black midwives.
Cheers
so
to
Black
you,
doulas.
Queen.
Thank you.
I hold up my lemon water.
So many Black midwives, so many Black doulas that are out there doing work and creating funds and places for Black people to have safe birth. So I know that I was honored and grateful to be featured in that number, but there are people who are doing incredibly more heavy and more intense work than I am. So we're all out here trying to make a difference.
Yes.
Once that birth center information is up and running, it will be on the website, and y'all will have the info of where to go. So we're working on it. So y'all send your good vibes and your prayers, because it needs to happen soon. So
yes.
I love it. I love it.
Wow.
Listen, when midwives speak, I just love it. I get tears in my eyes. So you do that, queen. We are holding you down and lifting you up. Thank you. You can follow me on Twitter at Dr. Poetry the Scholar. I'm the owner also of Dr. Poetry Speaks LLC, and website forthcoming, Shamika Poetry Thomas, aka Dr. Poetry. So you can Google that up. I'm also on LinkedIn, Instagram, Shamika Poetry Queen. So yes, one of my poems that is dedicated to Black women and the struggle, but also the resilience of Black women, is featured in Womanly Magazine, forthcoming in the next couple of days. It just went to print, so it is a centered feature of the magazine. So just stay tuned for that. We'll be in print, also online. So simultaneously with my science career, I combine that with my writing career. And all of this is to help women to be empowered of their bodies and their births. Women who are given birth biologically and spiritually, because we know birth happens in many realms, in many forms, whether you are birthing a body or birthing a vision. So the poetry book that is being written right now and being sent to the press forthcoming is going to speak about meditations and mantras and affirmations for women, period, goddesses. So thank you so much. It's been so lovely to be on this segment. I can't promise you that I'm always on social media. Honestly, I am really an introvert. I run away from the spotlight. I'm always kind of just tucked away. I try not to be an influencer. I'm mostly like someone who's in the background with a chakra bowl and a yoga mat. But I try my best to shine light on my followers when I can come from the shadows. But yes.
Well, thank you for coming out of the shadows for us today. And we will be remiss if we didn't mention, John, the connection between all the poet connection across the board.
Oh yeah, for sure.
Come on.
All these poets and artists and networkers and creatives and everything. So yeah, just thank y'all so much. We're gonna go ahead and close out. Everybody good? All hearts and minds clear?
Yes. I love it.
Yes.
All right.
Pass the collection plate. Pass the collection plate.
It's been another episode, y'all. We done did it. Street Academy Podcast.
I also just want to shout out the power of poetry and how it brought me, John, and Aiyana together back in our undergrad years when we were.
I love it.
When we were little teenagers and didn't know how to express ourselves. And
angry
poetry, little angry teenager.
Angry is a tool.
Yeah.
So I'm just poetry is a powerful thing, and then now we have Dr. Poetry here too. So it's just always I appreciate it. I'm sure Jackie could get a poem out if you really wanted to.
I mean, I enjoy listening to poetry. I enjoy reading poetry. So I'm right here with y'all.
Maybe we can have a poetry segment one day, just doing some poems.
That would be nice.
Let me know.
I love it, y'all. It's been another episode, Street Academy Podcast, where we keep one foot in the academy and one foot in the streets eats. Out.
Peace out. A-Town down.
DC, Chocolate City, baby. Chocolate City out here.
Oh, man.
Man.
Oh.
That got their feet upon the neck of the haters, the game and the devil like came in.